and good morning, everyone. Thank you for joining. Today, I'd like to talk to you about the thesis or the theme of my PhD, which is gut health in Parkinson's disease. I am a PhD student at the Department of Clinical Neuroscience at Cambridge University in the Barker and Williams Gray lab. Alan asked me to talk a little bit about myself, which is always a little bit awkward, so I tried to talk about the journey that got me here. So I graduated in Coimbra, which in many ways is very similar to Cambridge. It's an old university with a lot of history, and I studied clinical psychologist, and then I trained as a neuropsychologist, so assessing people's memory and thinking problems in a variety of different disorders. And then I moved to Lisbon to the Champalimaud Foundation, where I was both a neuropsychologist and a researcher looking at food reward related behavior in obesity, obsessive compulsive disorder, and Parkinson's. And I've always had an interest in science communication. So back in 2016, I invited John Cryan to talk about how gut microbes could influence our behavior. And after a nice job proposal to become a full-time neuropsychologist, I had a little existential crisis and said, right, so I either take up this job and I'm set for life, or I have one last adventure. And so I decided to refuse the job proposal and actually move to Cambridge to do a PhD. Which sounds much more sophisticated than it actually it is, because my daily life is basically dealing, storing, and handling stool samples. But let me tell you how interesting and how potentially beneficial this research is. So, of course, I wouldn't dare to explain what Parkinson's disease is to this audience, but I would like to say that although it's usually characterized as a movement disorder, it has a lot of other common features that are less discussed, both in clinic and in the literature. One of which, of course, is gut problems. I've recently published a list of the most common features of gastrointestinal dysfunction that is seen in Parkinson's disease, one of which is decreased frequency of bowel movements, meaning constipation. The rule of thumb is that if you have 3 or less bowel movements per week, you may be constipated, and that should be addressed. People often report straining, and that is usually associated with hard stools. So the effort that you need to do to push those stools out of your body is increased. You can also have incomplete evacuation. So you do go to the toilet, but you finish, but you still have a sense that you could do more, but you strain and nothing comes out. You can also have abdominal pain, bloating. These two are usually associated with what we call delayed gastric emptying. So all those peristaltic movements, the movements that we're not aware of, but that push our food through the mouth and out the other way. There's going to be a lot of graphic talking today, this morning, are impaired. And so because the food doesn't pass through the GI system as fast as it could or as it should, then you might feel a little bit of pain and distension. Another common feature is weight loss. Weight loss is associated with frailty, and so this is particularly important, even if you're overweight. Difficulty swallowing are usually a feature of more advanced stages of disease, but some people with PD reported earlier on. And it's basically having the sensation of having food go slowly down your throat, or being stuck, or sometimes feeling the need to cough while you're eating, and also drooling. Drooling can be quite embarrassing, but it also has important health consequences, because it can be associated with pneumonia, because you can choke on your own saliva. I have excessive saliva myself, and so it's actually something that I can definitely relate. Although drooling in Parkinson's disease, unlike me, is not related to the production of excessive saliva. Drooling in PD is associated with difficulty swallowing. So because you don't swallow as often and you don't even notice that you're not swallowing as often, and because sometimes with advancing age and with PD, you have a little bit of the tilting down of the head, saliva tends to accumulate in your mouth. You also have heartburn, nausea, and sometimes quite the opposite of constipation, where some weeks you can have constipation and some weeks you can have increased stool passing. So these the prevalence range is quite big, but it does seem to be quite a common feature. So this suggests that the brain and the gut might be related. And indeed, the literature tells us that there's a possible key link between the two. So constipation is now considered a risk factor for Parkinson's disease. People who are constipated earlier on in their adulthood are more likely to develop Parkinson's. Alpha-synuclein, the protein that has been associated with the disease, has been found in the gut of patients up to 20 years before they actually developed the diagnosis. And studies looking at stool samples between people with PD and healthy controls seems to suggest that the gut bacteria that live inside the gut seems to differ and seems to correlate or be associated with some of the key symptoms. There's also some evidence of bowel inflammation in the gut, and people with Crohn's disease or IBS, again, are more likely to develop Parkinson's. Now, I won't go into much detail about the mechanisms, but underlying this possible link is probably all of these factors combined. So how do the gut and the brain communicate? Well, one of the possibilities or the potential mechanisms is the vagus nerve. This is a nerve that directly links the gut to the brain. The immune system might also play a role because in PD, just as we just mentioned, there is inflammation in the gut, and that inflammation can go to the periphery, meaning to the whole body, and then affect the brain through a decreased blood-brain barrier, and also the gut flora. We'll talk a little bit more about the microbes and how important they are and how they might be affecting the disease itself. Okay, so if there's a link between gut and the brain, how do gut problems affect the daily lives of people who live with PD? Well, I think the best illustration is a picture of a stomach of a patient who took, and a lot of you might recognize your levodopa tablets, this yellow pill. This is an hour and a half before this participant took the pill. And an hour and a half later, on an empty stomach, the pill is still there. And so when sometimes our participants or our patients say, I take the pill and I don't feel better, perhaps it's because the pill is not properly digested or absorbed. But there's other ways in which gut problems might affect the way you experience your symptoms on a daily basis. So delayed gastric emptying, what we just saw, has implications on how you absorb your medication, but also how you absorb your nutrients. And of course, if you're malnourished, and a lot of studies suggest that Parkinson patients have decreased vitamin levels and nutrient levels, it will impact your overall health. Also, as I said in the beginning, swallowing difficulties and drooling are risk factors for pneumonia, which is particularly important. And meals seem to reduce the levodopa concentrations in your blood by about half an hour. Now, before I move on, it's also important to say that this gut problem that I just showed you with the intact pill in your gut might not be the reason that your medication is not as effective as it once was. The main reason being is Parkinson's disease is a progressive disorder. So by default, that means you will need increasing doses as time goes by. The other factor that might influence your daily experience of the disease is the bacteria that live in your gut. So the trillions of little bugs that live within us are mainly beneficial. So they digest our nutrients, for example, fibers. We don't digest our own fibers. We depend on gut bacteria to do that for us. But they also produce byproducts, such as vitamins, like vitamin B. They produce short chain fatty acids, and they produce neurotransmitters like serotonin and even dopamine. And there are studies showing that bacteria also help the absorption of medications, both related to Parkinson's disease and other medication. And also they can have a role in the side effects such as nausea and bloating that is associated with certain medication. Now, there's a lot of studies, and most have inconsistent results about which bacteria are most represented either by an increase or decrease in PD. However, these are the most consistent results. Yet, although there are a few main culprits or likely culprits, it's very hard to generalize these results because bacteria are very different between individuals. And even within an individual, we know that the bacteria within us fluctuate according to the meal we just had, according to our circadian cycle, meaning if it's morning or afternoon. It's affected by whether you smoke, your age, what medication you're on, and also different genetic sequencing methods, meaning the way we try to see which bacteria live in the gut, in the stool, provide different results and have different sensitivities. So this area of research is a little bit complex, and we can talk about that a little bit more in the Q&A. But okay, so gut problems very likely affect how you experience PD, but once you have PD and they're a risk factor to develop PD, but once you do have it, do they affect the way the disease progresses over time? So this is a study that we just published about a month ago now, in which we analyzed a big sample of about 400 participants who we followed up since diagnosis, so since time zero, up to 8 years after being diagnosed with Parkinson's disease. And we divided this group into 3 levels. So people with PD that had no constipation, participants with minor constipation complaints, meaning I do feel constipated, but I'll take a laxative and I feel much better afterwards, or major constipation, meaning constipation that is not alleviated by the standard laxative or treatments. And so when we followed up over time and we see the main consequences of Parkinson's disease, meaning cognitive or memory and thinking problems and balance problems, we saw that those with major constipation seem to have earlier onset of these memory impairments or these balance issues. However, when I then said, okay, there's this association, but could it be better explained by age or disease severity or disease duration? And while balance problems were, so constipation was just an indirect way to see disease, to see age and disease severity. In cognitive impairment, it seemed to withstand this adjustment. Now, this is really interesting. So people with major constipation may have an accelerated progression in terms of their Parkinson's. Although it doesn't seem like it, it might be good news, because all of the other risk factors that we know is older age at diagnosis, being male, so women tend to progress much slower than men do, and genetic susceptibilities, none of which we can do anything about. Now we have this fourth risk factor, constipation, which we can do something about, we can address. And so this is quite promising in a way, and interestingly not that surprising, because in 1817, in his essay on the shaking palsy, Dr. James Parkinson did say that he often prescribed laxatives to his patients, and their complaints were alleviated, at least temporarily. And he does write in his essay whether the gut and the brain could be somehow related, although it didn't really make sense because they were so far apart in the body. So 200 years later, we're slowly advancing this question and getting some answers. There's a few limitations of this study that we just did. First of all, it's only 8 years of follow-up, and although it's one of the longest in the literature, it's still not enough. So we are keeping we are following up these participants over time, so we can do a later and longer follow-up study. And also constipation was assessed by one single question. And constipation is a little bit, and gut problems in general, are a little bit more complex than that. So when we wanted to look at this a little bit deeper, we were surprised that in the literature, there is no particular scale to fully assess gut problems in Parkinson's disease. So we tried to address it by developing a new scale, which we called the Gastrointestinal Dysfunction Scale in Parkinson's disease. And it mainly is composed of 12 questions related to constipation, bowel irritability, and upper GI problems such as swallowing difficulties and drooling. How did we do this? So basically, I reviewed the literature and saw, just like in the table that I showed you, the main or most prevalent features of GI dysfunction in Parkinson's disease. And then I ran focus groups. I invited over 30 people with PD and their carers to have a very candid discussion of what are the symptoms that most affected them. So I showed them my list and said, does this make sense? Are there symptoms that the literature did not report and that I should include in my scale? Are the questions that I've developed, do they make sense to you? Is there anything else you would like to add? And so after about 6 hours of discussion, I developed a first draft of the scale. And then I sent it out in a post to more than 300 participants who were very kind enough. And this is just a few of the boxes that I had to send, and then that I received back. And so I know that a few of the participants that did this study are in the audience, and I just want to thank them once again for their kind time and consideration to our research efforts. And just look at that. You just, the participant in this scale, I just asked for a diary. So you just had to tick what kind of stools you had that day, but people actually took the time to do a proper drawing of which stools they had every single day for 7 days, and then they send it out to me. And so we're extremely thankful of that, because now with that questionnaire in hand, I can try to answer my question, which is, can gut dysfunction play a role in PD progression, and how? So the hypothesis is that perhaps gut dysfunction, as assessed by the scale and assessed by stool samples, leads to local inflammation, then reaches the blood, because with constipation and gut problems, the wall of the gut is a little bit more open. So if you think about a wall, it keeps the wall keeps all the bacteria in the right place so they can do their job. But with constipation, this wall can be a little bit open. Some of you might have heard of the term leaky gut. And so what happens is these bacteria get out of the gut, and so the body raises up a little immune system response just to clear the bacteria. It's not an infection, but the immune system is raised, and this immune activation might be reaching the brain and causing some problems, because sometimes the immune system kills the good and the bad. And so this might be explaining how we see a disease progression, an accelerated disease progression in people with gut problems. So what we're currently doing, this is ongoing now, is we're characterizing gut problems in Parkinson's disease, accounting for lifestyle, so diet, exercise, and other important factors that might be modulating both what is happening in the gut and in the Parkinson's disease itself. We're going to analyze blood. We're going to see whether there are those little microbes that shouldn't be in the blood, whether there's evidence that there might be. We're going to also analyze stool samples. Now, I'm not a microbiologist, and I don't have expertise in stool analysis. So AstraZeneca kindly offer to help. And so the stool samples that are kindly provided by our participants are then flown to Maryland, where they're analyzed by AstraZeneca. And this analysis will be done once a year for 3 years, so we can properly assess disease progression. Now, these are very preliminary studies, but this is to show you that although there's a lot of attention regarding gut dysfunction in Parkinson's disease, we don't know all that much. Until now, there wasn't a proper scale to ask these questions, and we don't know whether these gut problems differ according to age, according to sex, and according to disease severity. So this is a sample of about 200 people, so it's not enough yet, because, for example, in the early stages of the disease, I only have about 30 participants. So this might change, but currently it seems that all of the gut problems, such as constipation, bowel irritability, and upper GI problems, seem to be relatively stable over time. But this is a cross-sectional, so each disease stage contains different participants. I'm also trying to see whether it changes within the same person. So in this group of 50 people, I asked them to complete our scale and to see whether constipation changes with time. And a rough analysis shows that it doesn't. It's more or less the same thing. So these are the same individuals 1 year later. But then when I look at them specifically, it's very heterogeneous. So while most people don't change, some really increase their constipation scores, whereas most or some decrease. So again, I can't really interpret much, because this might change, but this is some of the groundwork that needs to be done at the same time as looking at the bloods and the stool samples. Right, so I've talked for a long time trying to show you that this association between gut and PD might be real and might be affecting you directly, but what can you do with this information? Well, there's a lot we can do. First, with constipation, I hear it often that people just assume it's part of old age or part of Parkinson's disease, and they don't even report it. They just take a laxative here and there. Please discuss it with your GP, with your PD nurse, and your consultant. Now that we know that it might be playing a role on how you experience PD, please tackle it. And you can tackle it in many ways. There's over-the-counter medication. There's also physiotherapy for pelvic and anorectic dysfunction, and biofeedback therapies that we know are beneficial. Anxiety plays a role, so it's very common, and we had a RIGeast presentation on anxiety in Parkinson's disease, and we know these are related. So tackling anxiety might also alleviate some of the gut problems. And squat, poo properly. Ask your nurse, how do you what's the best position to poo? And I'll give you a little head start. Most people poo sitting down in the toilet, as you would think, but actually the best way to poo is with a little step, a little bench, in order to lift your legs just a little bit, so the angle is the anorectal angle is slightly tilted, and it helps passing the stool. So especially if you're straining, try this and see if it helps. Weight loss is also important. If you lost weight, even if you were overweight and you now feel like this is a weight that you'd like to have, seek medical attention. Just do a blood routine check, talk to your GP, because it is associated with other health problems. And so it's something that we, again, should not be overlooked. For those with swallowing difficulties, you can be referred to an NHS speech and language therapist and do physiotherapy for that. You can cut pills in half and smooth in smaller portions and chew more. That usually helps. And with drooling, there's a lot of medication over the counter. So you can go to your local pharmacist and ask whether they can recommend anything for you, and they usually can. Also, be aware of good posture so that there's more swallowing, as well as swallow timers. And I saw a paper, a scientific paper that said that gum seems to help some people with PD. although I've never actually heard of it from one of our participants. And now the general advice in terms of timing, and remember that I said meals can affect the way your levodopa is absorbed, your PD medication is absorbed. General advice now is about 30 minutes before your main meal, have your medication, and about 2 hours before. Now, I know that you were probably, at least in the beginning, advised by your clinical care team to take your PD medication with meals, and that's for a reason, because Parkinson's medications are usually taken several times a day, and until you get into a routine, it's important that you don't forget. And the best way not to forget a medication is to try and couple it with main events in the day, and usually those are meals. But now that you're into a good routine of having your medication, try to take it on an empty stomach. And usually people say, oh, it has to do with the receptors and receptor competition. So I did a very gross homemade graph of what this actually means. So imagine this is the stomach wall and there's receptors. And these receptors, and this is a little levodopa fragment of the pill that you just ingested, and they will be coupled with the receptor and it will be absorbed by the body. But these receptors are not specific to just one single kind of food or medication. These receptors are multifunctional in the sense that they can couple to many things. And we now know that the receptors that are responsible for the levodopa absorption are also responsible for protein absorption, iron absorption, and at least in mice, banana juice absorption. And so if you can imagine that you took your levodopa with a nice steak, what will happen is that all of these that could be absorbing your levodopa, three of them are absorbing your nice steak. And so you can only absorb your levodopa fragments into two. Again, this is a very pictorial description of what might be happening, but I think it's important. And if you just take it on an empty stomach, you'll allow your body to absorb your medication for about 30 minutes or more, and then you have your nice steak. And hopefully your medication will have an optimal absorption. I, I know you've been told this over and over again, but I can't stress it enough, and I'll now do the link with gut. Exercise is really important for Parkinson's disease. And while everyone says that it's beneficial in terms of motor function, exercise also helps gut motility. And so perhaps part of the success in exercise helping with your Parkinson's is not only the overall health effect, but the fact that it helps the peristaltic movements. So the movements that push your food through and are slightly impaired in Parkinson's disease, with the movement, with the exercise, that might help. And of course, the Mediterranean diet. The Mediterranean diet has been associated with both a later onset of Parkinson's disease as well as a decrease in incidence of Parkinson's diseases in populations. But it's really important to stress that no diet is fit for all, including the Mediterranean diet. Diet should always, always, always be personalized. If you have swallowing difficulties, although the Mediterranean diet suggests that you should eat nuts and almonds, small, crumbling, dry foods might not be the best if you have swallowing difficulties. The Mediterranean diet is very rich in fiber. If you are gluten intolerant or if you have celiac disease, fiber should not be the main component of your diet. So again, while the Mediterranean diet should be the lifestyle that we should all adopt, at least for now, this is the current scientific evidence, it should always be tailored to your own needs. So do ask your GP to get a referral to an NHS nutritionist and discuss with him or her what would be the best diet or lifestyle for you. And of course, connect with others. Low mood has been associated with decreased appetite. If you're going out, if you're seeing friends, you're moving, you're eating new things, you're enriching your gut bacteria, and that can only be positive. And also participating in research, help us. So if you go to the Parkinson's UK website, for example, you can put your postcode and it will give you a list of research projects that are closer to you and that you might be involved. Now, these are the main standard treatments that I discussed, but there are experimental treatments. There are things that we're not quite sure are helpful, but we're tackling it. We're trying to find out. So if you ever wonder whether a certain probiotic or a certain vitamin supplement or any treatment for that matter, whether it's effective in Parkinson's disease, you can go to clinicaltrials.gov, and this is a website where most clinical trials are registered on, and I usually often use it. And so, for example, for probiotics, there's evidence that it is effective in ameliorating constipation and bloating, but not that robust of an evidence of ameliorating Parkinson's. That this could be about methods. So as we saw, constipation might play a role, but it's quite a long-term effect. So when clinical trials lasting about 1 to 2 years, it's probable that you don't see the beneficial effect just because you don't follow up participants over time. And it's also a tricky and messy topic, if you'll excuse the pun. So most probiotics in the market show no studies of reaching the gut alive. So you ingest bacteria. Probiotics are food products that have live bacteria in them. But our body was built to defend itself against against bacteria. So we have a really acid stomach, and we have a lot of mechanisms to make sure that most bacteria don't reach our gut alive. And if they do reach it alive, whether they're well enough to reproduce. And most probiotics include lactobacilli and bifidobacterium, which those stool sample studies show they're already increased in Parkinson's disease. So while most probiotics have these two, it's not like it's not like people with PD are lacking those two strains, although they do play anti-inflammatory effect. So again, the jury's still out on whether they're beneficial or not. However, there's a very interesting clinical trial currently going on with one probiotic for Parkinson's disease. They haven't published the results, but I am eagerly following them to see whether this field moves a little bit forward. So in summary, gut problems are frequent in Parkinson's. They do affect your quality of life in your daily living, and possibly they affect the disease process itself. So please be attentive to your gut. Ask questions to your GP, to your nurse, to your consultant. And many of these beneficial strategies are well within your reach because mainly they're lifestyle choices. Be attentive to new research on this topic, participate in research, and please bear in mind, this is not the full picture. There's much to be said. For example, there's trillions of bacteria, but there's also viruses and fungi in the gut that don't receive the same scientific attention. But I guess we can talk a little bit more about it in the Q&A if you wish. Before we open up to the Q&A, I want to first of all and mainly thank all the participants in the hundreds that have helped us study and research just a little bit more, just increase that much more the current knowledge on gut problems in Parkinson's disease. Our lab, my main supervisors, and my lovely now 4-year-old who potty trained about 2 years ago and gave me the stomach that I needed to handle stool samples on a daily basis. Thank you for listening, and I welcome all of your questions.
Brilliant. Thank you very much, Marta. It's fantastic. We have got a fair number of questions, and we're open for more. So if you have a question, if you can type it into the Q&A box, and we'll get to it as we go through. And as I say, we've got a few starters as well. And after the Q&A session, we've got a quick questionnaire survey for how the talk went down, so and give us some ideas for the future. So if you'd like to hang on for that. So we'll get started on some questions. I think one that's come up a couple of times is, are we in a position to say which gut bug species are good bacteria?
Not yet. So study results differ a lot in which gut bacteria are increased or decreased in Parkinson's disease, and we just don't know enough about it yet, especially because there's different sensitivity. So some studies report just the genus level or the family level. Some studies go to the species level, and this has different implications. I'll give you an example. One of the most robust findings across studies is that Parkinson patients have decreased prevotella in their stools. So we thought, okay, this is exciting. Maybe there's something, the disease process is somehow related to prevotella, but actually prevotella is linked to pneumonia and oral infections. So we would have thought that having normal levels or even increased levels of prevotella could actually be bad for you. So we don't actually know what it means yet. For example, E. coli is usually associated with infections, gut, stomach bugs. However, E. coli exists in our gut happily, just in very controlled numbers. And actually, Listeria, the family, so that family of bacteria actually produces dopamine in the gut. So again, I'm not a microbiologist, and we won't follow this particular line of research, but I'm very keen to see advances in this field, because there's a lot to answer still.
I think kind of related to that is a question about, I think it's fecal transplant. It's kind of referring to fecal infusion to improve gut bacteria. Have you?
Yes. So there are a couple of clinical trials currently ongoing. I know of at least 3, one in the Netherlands, a couple of in Asia, and basically FMT, as it's known for short, implies that someone with a given disease can receive the stools of a healthy person. And so this can be either by a nasal sonder, so a tube that goes up your nose down to your gut directly, or they dehydrate and put the stool of the healthy donor into a pill and you ingest them. Now, this is clinically approved for a gut infection called C. difficile infection, and it is approved by the FDA, and we know it's beneficial. We don't know whether it's beneficial for Parkinson's disease. Again, there are clinical trials looking at that at the moment, but in animal models, in rodents, in which mice with Parkinson-like features, when they were given stool samples from healthy people, their Parkinson's symptoms decreased. And then when they were given samples, healthy mice, when they were given samples of stools from people with PD, it seems to elicit some motor symptoms. So researchers are quite excited about that being a possibility. I don't know how successful the uptake will be from our community, but if not as a clinical therapy or strategy, at least it will help us understand a little bit more. It could be the gut microbiota that are being replenished in healthy abundance, or it could be somehow that this is having an anti-inflammatory effect on the gut, and that is the real reason why people would benefit from having a fecal transplant.
Okay, just looking for next question off the list. Where is alpha-synuclein found in the gut?
It is. I don't know exactly the the specific spot, and I think it will differ. So there are a few case reports where, for other medical reasons, patients had to do a colonic biopsy. And so they will probably depend on why the colonic biopsy was done in the first place. And it's also sometimes standard practice to freeze the rest of the biopsy that wasn't used. And so when researchers went back and analyzed those biopsies and saw that people with Parkinson's had alpha-synuclein in their gut. Now, there's alpha-synuclein in the gut and brain of people who never develop Parkinson's disease. So there's a lot of kind participants, and I will include myself in that. I've donated my brain to research. And so if I die tomorrow of, if I'm riding by bike and a car just runs me through, my brain will be analyzed by my colleagues. And so I'll be doing research even after I'm gone, I hope. And it's very possible that you'll find alpha-synuclein there. There's been alpha-synuclein reports in the gut of children. So the fact that you have alpha-synuclein in the gut does not mean that you'll develop Parkinson's. But the gut is one of the very, I wouldn't say few, there's actually more. Alpha-synuclein has been found in the heart, in the salivary glands, and in the brain. So alpha-synuclein in the gut is not a reason to think that it starts in the gut.
Okay, and there's a question about Lewy bodies in the gut. Could they be a biomarker for Parkinson's?
Yeah, so for the exact same reason that I just described, currently it's not a good biomarker. And we see the same, sometimes we see the same thing in Alzheimer's and the brain. So the beta amyloid plaques, although it's associated with Alzheimer's, there's a lot of older adults who die for other reasons. And then we look at their brains and they're full of beta amyloid, but they didn't have memory problems. So we're not quite sure what exactly it means. So currently alpha-synuclein is not a good biomarker. For example, alpha-synuclein is detected in the CSF. So the liquid that is in your spine and goes up to your brain, and also in the blood. And there's a lot of studies trying to see whether alpha-synuclein in these biofluids is a good marker for the disease, and sadly it's not currently. So a lot of research needs to be done because it's not a linear relationship.
Okay. Next question, are you investigating the possible link between increased gut transit time and constipation?
I am not, but I am debating that possibility. So I have initiated a collaboration with a gastroenterologist who, in the subsample of this group that will be assessed over 3 years, will look at transit time. But this is actually quite expensive to do and quite laborious. So the 10 participants who I will eventually ask to do this will have electrodes in their stomach, and we'll see whether how long they take to digest a meal. They'll also swallow a capsule with a camera, and we'll monitor how long that capsule lingers in the gut, in the stomach, and in the different parts of the gut. But that will be only a subset of participants in which we're looking at that for logistical and other reasons. But you can do this at home if you want. There is the Blue Poop Challenge, I think led by Tim Spector, where you can basically just cook a muffin at home, just a simple muffin recipe, and add blue dye to it. And so you'll eat a very blue muffin, and you'll jot down the time and the day in which you ate that muffin, and then just be attentive to your stools in the toilet bowl and see how long it takes for the blue muffin to come through the other end. And so it should be about 24 to 48 hours. But yeah, that's just a simple homemade version of transit time that we can all try at home. Actually, I was going to try that myself, but the muffin that I made was horrible. I'm not a very good baker, so I'll have to try again.
Fair enough. I'll look for the grant coming through for the training on that one. So next question about iron as a micronutrient linked to microbiome function.
Did you say iron?
Iron, yes.
Yeah. So what was the question again? Sorry.
So iron is linked to microbiome function, bowel function, but also Parkinson's progression. PD is more common in males who maintain higher iron status, at least up to age 50. Have you any thoughts on whether the linkage between bowel and nutritional factors and PD may include an interaction with iron intake and human and microbiome metabolism?
That is a very interesting question, and I know that a lot of other research groups are tackling it directly. And again, there's probably not one single mechanism through which the gut and nutritional levels are affecting the way the disease progresses. So, for example, in constipation, while we're trying to link it to inflammation, constipation is also associated with malabsorption, and particularly in the vitamin B complex, which is associated with a good cognitive performance. So again, constipation might be accelerating the disease because of its pro-inflammatory effects, but also because people with constipation might be slightly malnutritious. They might have decreased levels of B vitamin, which then can lead to memory problems. The same thing could be happening with iron, but I'm not completely familiar with the literature or the mechanisms, or whether we now know mechanisms. I know there is an association with increased iron levels and, for example, decreased zinc levels, but whether that's a mechanism, a mechanistical association, I don't know. I don't think we know.
Okay, the next question, I think you pretty much answered in the talk, but would it be good to have GP, PD nurse and PD specialist available for regular contact? I think the answer to that is a strong yes.
Well, yes, but I think I'd like to expand a little bit on that. So, Parkinson's disease is a slow progressing disease, and if you're well managed, then I think it's reasonable to be seen once a year by your consultants and once every 6 months for your with your PD nurse to discuss any issues. I know that some of our participants don't see their consultants for 2 years. Some see their consultants several times a year. That also has to do with how they're experiencing PD, whether they have complications, whether they have medication issues. So again, of course, regularly is desirable, but it also has to do with how well managed you are. And sadly, with medication, it's still trial and error in terms of tweaking the dose that best optimizes your daily living. And in for that reason, until you tweak it just right, you will need a little bit more regular care. But once you stabilize, then I would assume that you can lead a healthier life without having to go to hospital appointments. That's the goal for everyone, isn't it?
Okay, that's good. Next one, is it worth having a microbiome test to see which bacteria the PD gut is lacking and then treat accordingly, maybe with supplements?
We don't know yet. We don't know which bacteria are beneficial or detrimental for Parkinson's disease. And so we don't know exactly what should be replenished or not. Again, with the most probiotics containing bifidobacterium and lactobacillus, study shows that people with Parkinson's disease don't lack those. So I don't know what we should be replenishing in the first place. Should be replenishing Prevotella because it's been decreased in Parkinson's disease, but Prevotella can give you infections. So yeah, it's a little bit tricky at the moment. I don't think we can start turning this scientific knowledge into practical guidance just yet.
Okay, Liz, are there many questions coming through on the chat side?
Chat side.
There are a couple questions. I don't think you've answered these yet about fecal microbiome tests. Is it worth having them done privately? And also people commenting on fecal infusions or fecal transfers to improve gut bacteria, gut health. Do you have any comments on those points?
So yes, because we don't know which bacteria are good or bad, I don't think there's any benefit of having a private stool microbiome test per se, or not just yet. Same with fecal transplants. As I mentioned before, although there's some evidence suggesting that they might be beneficial, we don't know yet. And although I know that somewhere in the UK there are companies who are selling this privately, this service or this treatment, because the clinical trials in Parkinson's disease are still ongoing. I think I would wait for that, because no treatment is without side effects or health problems. And I don't think I would, if I had Parkinson's, I don't think I'll be ingesting someone else's healthy stool sample without making sure that it could actually benefit me in some way.
Very much, Marta. And another question, can having a waterborne infection lead to Parkinson's, or a serious water bacterial infection in the past trigger Parkinson's in later life?
So there's no single event that can cause you Parkinson's, not that we know of just as yet. So my gut instinct would be no, it didn't. However, in the literature, what has been constantly reported is that chronic infections seem to be associated with an early PD onset. So the thing is, it's probably not one mechanism. So people with Parkinson's disease who have, for example, multiple urinary tract infections often describe getting a little bit worse. They have a little dip in their motor symptom, or I should say a little increase in the motor symptoms after an infection. And they know that infections, again, if recurrent, are a bad factor for disease progression. However, one single infection that I know of won't make the difference. It could have triggered it though. So if you think that Parkinson's disease is caused by a multitude of factors, including genetic factors, environmental factors, uh, maybe diet does play a role, lifestyle plays a role in terms of smoking habits and not. And so that infection might be another cumulative effect, but that I know of, it wouldn't have caused it directly.
Thanks, Marta. And a question about indigestion and the vagus nerve. So indigestion sometimes produces pain in the side of the neck. Would that be your vagus nerve complaining? And a question related to the vagus nerve about its role in transmitting alpha-synuclein from the gut to the brain.
Yeah. So indigestion causing pain in the neck, I had no idea that this was an association. Please do talk to your doctor about it. I'm sorry I can't answer that question. I really don't know. And regarding the vagus nerve being a potential mechanism, yes, there have been some studies, again in animal models, where you inject alpha-synuclein in the brain, and later on it was that alpha-synuclein had a tracer, had a fluorescent dye, and later on that alpha-synuclein was also spotted in the gut, and vice versa. So we know that at least in mice there is cell-to-cell transmission. In humans, it's a little bit more complicated because we shouldn't inject alpha-synuclein in the brain and see if it follows up in the gut or vice versa. But it could definitely be an association, because epidemiological studies suggest that people who had their appendix out or had a vagotomy, meaning they severed the vagus nerve for clinical reasons such as stomach ulcers or gastric cancer, they have a decreased likelihood of developing Parkinson's, or they develop it later on. There's other studies with longer follow-ups showing that they don't, but because your likelihood of developing Parkinson's increases with age, longer follow-up studies diluting that association isn't that surprising. So yes, the vagus nerve seems to be implicated both in animal models and in humans. We don't know much about it yet. I know that vagus nerve has also been implicated in depression, and there's actually therapies looking at vagus stimulation that I know of. There's none in Parkinson's disease, but it's definitely a mechanism. Although in our group, we focus on the immune system and its role in the mediation of the gut and the brain.
Okay, so we've got a few more. I think we probably won't get through all the questions in time, but we'll see how we get on. There's a few questions about kefir milk. Is it beneficial? Is there anything you'd like to say about that?
Well, I love kefir. I actually have kefir on a daily basis. But again, like I said about the Mediterranean diet, it does not fit all, and you should always carefully consider whether kefir or any dietary product is right for you. Let me give you an example. Kefir has been associated, it's a fermented food, so it contains live bacteria. It has a very stringent live bacteria taste to it that it does not agree with all. My partner doesn't like it. And it has been linked to longevity and overall improved health. But because it has a very specific flavor, most kefir manufacturers include lots of sugar in it to mask the flavor. And so if you're diabetic or if you have high blood sugar levels, so you're pre-diabetic, then you shouldn't take kefir. That's why it's important to whatever lifestyle or diet you follow, you make sure you've seen a nutritionist and you have routine blood checks to make appropriate choices for you. Another thing that we have to say is that people react differently to foods. Certain foods you might have an intolerance to that are considered healthy. And so if a certain food doesn't agree with you, no matter how healthy and green it is, just don't eat it. Even if it's in the Mediterranean diet. If kefir doesn't agree with you, don't take it, even though it's supposed to be good. Nothing is good or nothing is bad. What I'd like also to add to the diet talk is it should be a lifestyle. So it shouldn't be a short-lived diet, because study shows, especially with the microbiota, is that once you stop the diet, you revert almost to your previous microbiota signature. So kefir, the Mediterranean diet, whatever you choose to do, it should be a long-term effect, just like exercise.
And another good question here. Whatever happened to the squalene story as a blocker of synuclein aggregation and constipation?
So I actually reviewed a scientific paper, I think it was last year, on squalene, but the clinical trial had a very, very small sample size. And although squalene, again, in mice models, seems to increase the contraction of gut wall in electrophysiological studies. So in petri dish, if you get a little bit of tissue from the gut and you add squalene, it increases contraction. So we know it helps with constipation. The clinical trials have not been that robust. So I don't know how the story will end. I know it's still an active area of research, and I know it might be playing a role in the gut, but I don't know if there are phase 3, so big, large clinical trials looking at squalene in Parkinson's disease progression or motor scores.
Okay, there's a request here for a copy of the GI dysfunction scale form. Is that something that you can?
Yes. So the Movement Society, MDS, Movement Disorder Society, sorry, asked us to manage the scale. So if it's for non-profit organizations, it should be free for all. So email me or email the Movement Disorder Society for a free copy. That should not be a problem.
Okay. So looking through the rest of the questions, that mostly.
Here's my email address.
Good point. And we can perhaps include a link to that in the email we'll send out afterwards with reminders. So a lot of the other questions, just mindful of the time. What about water intake and constipation?
Sorry?
What about water intake and constipation?
So yes, I didn't talk about water intake, did I? That's fundamental. So a lot of the hard stools are actually linked in my GIDS scale has a question looking at water, because most of the studies looking at constipation did not account for water intake, and we're making sure we do. We're accounting for smoking, water intake, exercise, and overall diet. Because if your water intake is low, your stools will be harder, so they won't be as soft, and so you'll have difficulty passing stool either by straining or by the transit time will be slower. So drinking water is fundamental for constipation, and please do address that before you try to take laxatives. Try to eat a more fibrous diet. Again, the fibers, one of the reasons why they help with constipation is that they swallow up with with uh, water, but they also become soft. So the stools are softer when you eat fiber, and that's a good thing because it just helps them pass through the whole track. Um, and yeah, before you try laxatives, try a high fiber diet if it agrees with you again, and water. I think water is the only thing that doesn't have side effects, except if you drink too much.
And similar question about tea and coffee, I guess. Do they help or hinder the occurrence of constipation?
So coffee and tea, but mainly coffee, can be pro-inflammatory. So by inflaming the gut wall, it can exert a laxative effect. And studies show that coffee could be protective for Parkinson's disease, but I don't think it's that simple or that linear. Apparently, a little bit of coffee is fine. Too much coffee is again detrimental. Um, Again, I think it's a trial and error thing. So if you feel constipated, perhaps before trying a laxative, drink a nice espresso, and that might just solve it for you.
Sounds good. So a couple more. There's a mention of Dr. Anne Liebert's research in Australia, which involved shining a red laser light on the abdomen of a person with Parkinson's, and that changed the microbiome. Do you have any comments about that? That was one of the pre-submitted questions.
Yeah, so I read up on that because I wasn't that familiar with the literature. So there's, I think it's called photobiomodulation, and there have been studies looking at photomodulation in the tongue, in the brain, and now in the gut of people with Parkinson's disease. But there are no clinical trials looking at shining a light on the stomach of participants and their amelioration of the PD symptoms. What Dr. Liebert, I believe, has shown is several case reports where patients are exposed to that light in the gut and feel better, and there's changes in the gut microbiota. But again, only a clinical trial in which patients do not know whether they're receiving the good light or the bad light, and the researchers are also blind, and then having a blind analysis will be the only way to see whether it's actually affected or not. But case reports show that it could be a thing. We don't know how exactly, but one of the things could be if it is modulating the gut microbiota is because it's affected by temperature. So shining a light can change the temperature of the gut, and also the gut bacteria are also very sensitive to the time of day. So it changes, at least in mice, changes with your circadian rhythm. So maybe shining a light could somehow disrupt this, and whether it's beneficial or not, I wouldn't know. But I'm sure Dr. Liebert will follow up those case reports with a proper clinical trial.
So just mindful of the time, we'll take one more question from the list, and that is, thinking about diet, are there any populations that have extremely low or no Parkinson's disease, which might indicate that their microbiome is different?
If I understood the question correctly, there's Well, there's two, one as an increase and one as a decrease. So Prevotella is known to be decreased in Parkinson's disease, and that's quite a robust finding across studies. I did look, when I started reading this literature a couple of years ago, I did look on Prevotella-rich foods, and I couldn't find any, and I'm not sure whether that would actually help. And the other one is the increase is H. pylori infection. So apparently it's quite common in older and in any adult population to have an H. pylori infection. And in most cases, you don't even have symptoms. But a lot of studies report that when you take that antibiotic to treat the H. pylori, your motor symptoms from your PD might improve. Now, we don't know whether it's the H. pylori eradication or whether the antibiotics that we now know that exert a very powerful anti-inflammatory effect, and whether that is alleviating the motor symptoms. But yeah, those are the two strongest association between bacteria and Parkinson's disease. One is increased, one is decreased. Whether addressing those makes a difference or not, it's still, the jury is still out.
Okay, so I think in mindful of the time, we should draw it to a close there. Thank you very much. That has been really brilliant. I just draw your attention to the questionnaire, which should be on the screen for you now. We really would like to know sort of who's attending these and what we're getting from them, so that we can sort of shape the next few presentations that we do. And on the screen now, we've got contact details for RIGeast, the Research Interest Group for the East of England, and the Parkinson's UK website and helpline. We will, as I say, we've recorded this, we will make it available later for replay, and we'll send out an email with a few details of things that we've talked about along the way. But just in closing, I'd like to thank Marta very much for what's been a fascinating presentation on a subject that's really important to all people with Parkinson's. So thank you very much.
Thank you. It was a pleasure being with all my participants online and those who are keen in learning a little bit more about this.
And thanks to everybody who submitted questions, and to Liz for flying the Zoom. So we'll close there. Thank you very much.
Thank you. Bye.